Hello everyone, welcome back to Smith Saturdays here with Brendan Smith at Clearwater Physical Therapy in Thickwood. You can probably hear it in my voice, I'm fighting a head cold, so if anyone has any home remedies they could possibly give me to get rid of the sinus infection, please comment, it'll be a huge help. So today we're going to talk about concussions again. Last week we kind of talked about what a concussion is in regards to a metabolic injury. What we're going to talk about today is signs and symptoms. So I'm sure the average person when they think concussion can probably list off a few of the main signs and symptoms. Headache, dizziness, lightheadedness, confusion. Not necessarily, but if you got your head injured at a sporting event or from a fall, maybe you lost consciousness, maybe you had a little bit of bleeding coming from the nose or the ear that you want to go down to emerge. Those are all your typical things that you expect to see from a physical report of pain and awareness and so forth. But what we really start to see in someone who has concussion for any length of time is reports of feeling depressed, moodiness, drastic emotional changes, energy changes. That's when you're really getting into the long-term effects on the brain, when you start to see not just physical symptoms, but also signs that how do you look in the face? Do you look really sad? Do you look moody? Because it's really started to affect your life. One of the other big things too is that the more stimulating the environment that you're in, the worse your symptoms are going to get. So if you do have a fairly significant concussion and you're a student, for example, walking down the hallway of your high school with lots of classmates, lots of noise, to then sit in the back of a classroom, look at the teacher, look at the board, write notes, see your friends, look at your phone from time to time, that's a lot of stimulation to your brain, a lot of feedback, going to cause a lot of problems. You're out working on site, lots of noise, trucks, you're looking up at scaffolding, you're looking down, you're swinging around tools and so on and so forth. Or you're sitting at a desk, looking at the monitor, looking at your phone, answering the phone, lots of head movement. That's a lot of stimulus that will definitely flare up symptoms if you have a concussion versus just, for example, a neck injury. So next week we're going to get into what a typical assessment for a concussion is going to look like. As always, please ask some questions. Enjoy your long weekend. Cheers.